My name is Donna Riedel, and I'm going to be assessing James Smith today. He's been diagnosed with terminal colon cancer, and we are going to be discussing his hospice care. Prior to our start of your assessment, Mr. Smith, I'm going to go ahead and read this statement, and I need for you to agree to the consent, okay? You understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. You allow the information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by students as soon as it has been reviewed and graded. You further acknowledge that this is for educational purposes and only the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the students, are not considered liable. Do you agree, Mr. Smith?
Yes.
Okay. So I'm going to go ahead and ask you a series of questions today, and it might take a little bit of time, but it's just important that I get some type of background on you prior to getting this assessment put in. Mr. Smith, do you smoke?
Not anymore.
Okay.
I did.
You did?
Yeah.
Okay. And how long did you smoke?
Approximately 25 years.
Okay. Do you drink alcohol or abuse any type of street drugs?
No.
Okay. Have you ever?
I used to drink.
Okay. But it's been quite some time?
Yes.
Okay. Do you wear glasses or contact lenses?
No.
Okay. Do you have any false teeth?
No.
Have you had any recent headaches or blurred vision?
I get headaches quite a bit.
Okay. And what have you been taking to help that?
Well, some of my medications that I get from pain management.
Okay, like the hydrocodones
Yeah.
and things like that? Okay. Does that seem to help?
Well, yeah, and I also supplement that with just regular Tylenol and
Okay.
and stuff.
Okay. Are you having normal bowel movements?
No.
No. Okay. Is it a lot of diarrhea or? Yeah.
Primarily.
Okay. Have you gained or lost any weight in the past 3 months?
Okay, yes, I've lost quite a bit of weight.
Okay. Are you experiencing any weakness? Oh, excuse me, I'm sorry. Are you sleeping well?
No.
Okay. About how many hours a night, approximately?
Well, I'm pretty much stuck in this bed. I just kind of toss and turn pretty much all day, every day.
Okay. Do you have any pain in your body at this time?
Yes.
Okay. Where's the pain located?
It's all abdominal.
Okay. All right, I'm sorry. Have you had any nausea or vomiting?
Yes.
Okay. Oh, and the pain, what number would you give your pain on a scale from 1 to 10? 10 being the very worst.
Well, I just took my prescription, so I would rate it probably right around a 4.
Okay. Let's see. Do you have any rashes or bruises to your body at this point?
No.
Okay. Any sore throats?
No.
These are spiritual questions. I hope that you don't mind if I ask you those. Do you belong to any church or spiritual group?
I have attended several churches in the past. Obviously in the last several months I haven't been able
To go.
go.
Okay. Do you consider yourself a spiritual person?
Yes.
Okay. During uncomfortable events, do you take your concerns to a higher power?
Yes.
Okay. Are you comfortable speaking to someone from our spiritual care team if needed?
Sure, certainly.
Okay. Let's see. How about, do you belong to any groups or organizations?
Not anymore. I used to when I was younger.
Right. And the next question probably would be in the past, but did you used to exercise or do sports or anything regularly, or?
No, not too much.
Okay.
I did play some sports, but
Okay.
nothing for any extended period of time.
So, when did you work last?
It's been almost a year ago.
Okay. Where did you used to work?
I worked at Whirlpool.
Okay. All right. What did you do there?
They was a shipping and receiving dock manager.
Very nice. What types of hobbies do you enjoy?
I used to like to fish and go bowling and
Okay.
stuff.
Are you still able to fish at all?
I haven't. No.
Okay. Do you have a significant other?
Yes.
Okay. And do you live with that person now, or any other family or friends?
Yes. Yeah. My wife still lives here.
Okay. Do you have a good support system for what you're going through?
Yes,
Okay, good.
and with the help of hospice, I think it'll be
A lot
even
better.
better, yeah.
Sure, okay. Would you consider yourself to be social?
Not so much.
No?
No,
Okay.
so this being in bed,
Has made it really difficult, I'm sure.
Yeah.
I'm very sorry. Do you feel you have solid relationships in your life?
yeah,
Okay. Have you ever been diagnosed with depression or any psychological disorders in the past? No. Do you feel as if you're depressed now?
I think I was when I was first diagnosed, but I think I've come to
Terms with
terms with it, yeah.
So have you had any excessive crying, sadness, or lack of motivation?
No, not recently.
You just said that you spend a lot of time in the bed, though?
Yeah.
Okay. Do you feel angry about your diagnosis?
At times,
Yeah.
but that doesn't get you anywhere, so
Okay.
I'm pretty cool with it.
Okay. So you don't hear like any voices telling you to do anything bad? You don't feel as if you want to
No.
harm yourself because of your diagnosis or anything like that?
No.
Okay, all right. Well, our care is basically going to be surrounding you with support, and we want to keep you comfortable, and we'll have paperwork for you to sign, such as do not resuscitate paperwork and things like
I
that.
understand.
It's very, we'll have a social worker that will do that with you. But it's very important that we feel as if we have given you the tools that you need to understand, what's going to be happening when you become a hospice patient. You basically are forfeiting your privileges to be seen in the ER and things like that. You
Right,
realize,
yeah.
now if there's bleeding or different things,
Yeah,
that
actually
going
the
on.
social worker at the hospital that set this
Okay.
up with you pretty much went over a lot of those
Okay,
guidelines.
good, all right.
So I'm fairly aware of.
Okay. Well, I want to let you know that not only will I be one of your nurses, there will be several of us, but I do want to make sure that I always give you the education that you need, and I want you to feel as if you're comfortable talking with us. I'm one of those nurses that feels very comfortable praying with my patients. Not every nurse does do that, but our help for you is definitely very open-minded. If you need to talk to one of us, you can call the 800 number and they'll be there for you. And we're here right now. What we're focusing on is keeping you comfortable, and I want to make sure that you feel as if you're ready for the next step.
I
And I know
appreciate
it's very
that.
difficult, but okay. So I thank you for speaking with me today and going over this information, and I'll definitely be back with you soon. Okay?
Thank you very
Thank you very
much.
much.